My name is Giancarlo Russo and I come from Roma, Italy. I spent, I would say, the biggest part of my life traveling around and studying with the biggest names of rehabilitation and hypnosis. And wherever I go, I work with clients and I see patients. It helped me to understand that the patients I see in Italy are quite different than the patients I see in Czech, the patients I see in Poland or in the US, because each and every culture allow the patients to have a different idea about the pain. In some culture, pain is pervasive of the society. In some other countries, pain is something you have to erase and not to cope with. And this is very interesting to see also that from country to country, the percentage of painkillers that they sell is quite different. Nowadays, painkillers are one of the most sold pharmacological categories in the world, because people have to go working, so they take painkillers and they are not aware of the risk that are related to the painkillers. It doesn't mean that I'm saying that you don't have to take painkillers. Sometimes it's necessary. I'm saying to you, you don't have to abuse, and that some kind of pain you can erase, you can control, you can manage also without painkillers. But the first rule is trying to modify a symptom without a diagnosis, it's criminal. So be sure about the pain before you try to modify the pain. Hypnosis doesn't substitute any therapy you're doing, but hypnosis reinforces all the effect of the other therapy that you're doing for your pain. If you ask me what is hypnosis, I have to answer this question according to what science tells us. But first of all, the most important thing to explain people is what hypnosis is not, because many people has their own idea about hypnosis also if they never have been in contact what hypnosis is. Why? Because of course we are under the influence of TV or cinema, and everybody when they see some movie they have the idea of what hypnosis is, and sometimes this idea doesn't correspond to the reality. Hypnosis is not a battle between two brains. Hypnosis is not sleeping. Hypnosis is not dangerous. So, what is hypnosis? Hypnosis, at least, is one normal software of our brain. In this moment, we know exactly 4 ways through which our brain works. Our brain can work in an awake state, our brain can work into sleep state, then dream state that is different than awake and different than sleeping state, and then it can work under all the variation of the state of consciousness. Hypnosis is one among all the different way of variation of state of consciousness. If I have to ask scientifically to hypnosis, I have to say that hypnosis is a normal software of the brain when the brain is completely focused on one idea until the point that the idea takes the control on all the other ideas of the brain. Hypnosis can help the patient to overcome different situations, such for example pain, where hypnosis finds one of the most interesting applications. Why it can be so helpful in the case of pain? Because hypnosis can shape your reality. Hypnosis can modify your sensation, and pain is a sensation, of course, an unpleasant sensation, and it can be modified by your brain. There are several explanations of what happened during hypnosis. According to some theories, our brain works through some waves. We're talking about alpha, beta, and theta. Beta waves are related to a awake state. When the brain starts slowing its activity, you go into the alpha state. There is a state of the typical focused attention until you can go into the theta. There are the typical wave of the sleeping phase. But I like to do a different kind of hypnotic induction. Sometimes when you hypnosis, you go through a deep state of relaxation. You start proposing some beautiful image of the tension that leave your body and so on. But there is another way to induce the hypnosis, and it's through a strong stimulation of a little structure of your limbic system that is called amygdala. What does the amygdala do then? Amygdala store emotional memory. And when you're exposed to an event, amygdala is looking if this event could be a danger for you. And then it decides if it is not a danger, it leave the prefrontal cortex do its work, so taking a decision. But if there is a danger, amygdala get activated and push strong until you go into the fight or the flight reaction, so to deactivate the prefrontal cortex and the person go slowly into this different state of consciousness I was talking before. And this is what we call hypnosis. Choosing the best hypnotic induction is the most big skill of the hypnotist. We have visual techniques, we have auditory technique, and we have synesthetic technique. So we have technique for each and every kind of patients we have in front of us. Some people need eye stimulation, for example, moving the fingers in front of his eye. Some other people need auditory, so I let them close their eyes and I give them some words to induct. And some other people are inducted by the touch on their body. When people ask me, how can hypnosis help with pain? I have to start sharing the two biggest characteristics of pain: acute pain, non-acute pain. Now there is a big debacle. Should we call it chronic? Should we call persistent? Mean nothing. There's only the blah 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 of people that have nothing to do. Chronic pain, that's the real name, because it doesn't have nothing to do with the time related to the perception of pain. Because when pain from acute is becoming chronic, it's still acute. Can you understand? Acute pain is the moment when there is a strong relation between cause and effect. I have pain because I sprained my ankle. But if this ankle is still in pain after 1 year, this relation doesn't exist anymore. So there is for sure one moment when this pain from acute became chronic. So what happened in the person? So to make this pain change from acute to chronic? That's the big question I always give myself when I treat my patients. I cannot find a relation. There's no any mechanical problem there. So what happened? It's easy, believe me, it's easy to say pain is in your brain. So what does it mean? Am I crazy? That's what people answer me. No, pain is in the brain because here is the place up from thalamus where the pain is managing in your brain. In hypnosis, we know very well something. You have two ways to work on pain. You can work on the pain pathways in the body, or you can work on the emotional component of pain. On the emotional component of pain, you can work on the highest majority of patients. So to reduce fear related to pain, to reduce anxiety related to pain, and to reduce pain itself. With some people very good trained, you can work also on pain pathways, like pain conducting ways, on body parts. There's a very interesting quote that more or less says like this: if somebody experiences a throat pain, but the move is interesting, maybe for 2 hours, he didn't feel any pain. What does it mean? Sometimes our mind can increase or can decrease the pain according to what happened to us, to our environment, but especially to our memory. Am I wrong if I say that maybe pain could be also a memory? Because we refer always to pain like if pain is one thing. No, we have several different kinds of pain, several different levels of pain, several different interpretations of pain. There are some kind of pain that the patients experience so many times that they exactly know when the pain spread, the way it spread, the location it spread, the time the pain will last. So am I wrong if I say that it's triggering a memory of that pain, right? One of our best technique is the spatial and temporal pain distortion. So one pain that normally can take 5 or 6 hours, I can concentrate in 1 hour. That's a big result. Which kind of pain I'm talking about, and if somebody of you already experienced, I'm talking about migraine. Some people exactly know how long the migraine will take. I'm talking about the period pain in women. They exactly know when the pain will start, how the pain will spread, and how long the pain will take. Pain is a mystery. We are still struggling with pain. Thanks God neuroscience and thanks God technology is helping us to understand a little bit more about pain. Each and every person experiences pain in so many different ways that we can say that is not possible. The same low back pain is the same pain experience in different people. Hypnosis can be seen not only as a clinical tool, but also as a communicative strategy. That's why when people ask me, Giancarlo, but you normally do hypnosis or you do rehabilitation to patients? I say, I do both. Because for me, it doesn't make any difference if I use hypnosis as a clinical tool or as communicative strategy. Why should I combine rehab and hypnosis together? Because I know exactly that to do a good rehabilitation, I need the patient's collaboration. I need to reduce his anxiety and I need to decrease his muscular tone. And I can obtain this with hypnosis, so to make the result of my rehabilitation session even more stronger and more deep.